Good afternoon, everybody. This is Dr. Alison DiBarto Goggin with Little Black Bag Medicine. I forgot I was supposed to put in my headphones, so sorry about that. So, today we are talking about chronic infections, chronic fatigue, chronic illness, basically anything that falls under the category of nothing's wrong with you, we don't know what's going on, maybe you've been labeled with fibromyalgia, and you've just been checked for those pain spots and that's it and told to go home. Here's a prescription or antidepressants and see what happens. So there is hope for you if these are something that you're struggling with. So if you've been chasing symptoms like chronic pain, inflammation, you always catch everything that goes around. You have chronic digestive issues, anxiety, depression, chronic sinus infections is another big one. Thyroid disease that's not getting better with any treatments. And then adrenal fatigue is another one that are symptoms that we're chasing instead of finding that underlying cause. So most people who have underlying infections, and we're going to get to what that means in just a second, it feels like everything you do gets you like 10% better, or maybe even 25% better. And then as soon as you feel good, like 1 or 2 weeks, sometimes 3 or 4, you get hit by that train again and you fall apart. And you're like, man, I thought we were on the right track. I thought this was working. What happened? What am I doing wrong? So that if that is you, you need to start looking at underlying infections. Another problem is that Lyme disease, Epstein-Barr, a lot of these underlying infections mimic and look like rheumatoid arthritis, which is RA. It looks like ALS. It can look like Alzheimer's. It can look like these big, deep problems that there aren't answers for. So it can be really, really difficult to manage. So, and the other part is if you're misdiagnosed and you're going to get the wrong treatment, we want to make sure that that's not happening for you at all either. So the question that functional medicine always tries to answer is, why is this happening? Which system is down, not which symptom should we be chasing? Because true health is not a symptom to fix. It is a system that needs to be supported. And that's really important to remember. So what is a chronic infection? So think of something like mono, which is Epstein-Barr virus, strep that your body never clears, or Lyme disease, and your body just is unable to kill that pathogen or that virus or the mold, and it just sits in your body, replicating, doing its dirty work, causing inflammation. And then this inflammation starts causing chronic conditions like heart disease, like depression, like anxiety, like Hashimoto's is a really big one. So we have to find out what's going on. Another thing that you can look for if you're experiencing these issues is that your blood work, your liver markers might be up, your monocytes might be up, which is also a chronic infection. And most docs say, oh, don't worry about that little guy because it doesn't mean anything, especially if it's the only one showing up. If you have autoimmune markers that are popping up, but your doctor says there's nothing wrong with that, don't worry about it, you can start thinking, gosh, I gotta find somebody who knows what they're talking about, like me, and we can help walk you through that and say, wow, what's causing these to come up? Because autoimmune issues are often have underlying pathogens and underlying issues that's causing the body to attack itself. So we don't go after the autoimmune issue, we go after what's causing it. Um, the other problem is you might see nothing at all. And that's why we have to dig a little bit deeper. This is why I use symptom surveys. I use disease specific surveys as well, especially for Lyme disease, a total health history analysis, and then we can use other labs like stool analysis can test for different types of bacteria. I have a urine test that tests for different types of bacteria, immune issues. We have targeted immune blood tests. We can do it all. We just need to know what's going on first. So what should you do if you think you have a chronic infection? Well, number one is to get tested. So start with a simple blood test, get an Epstein-Barr panel run, do a urine or a stool test to make sure that you don't have a bacterial process going on. And that way we can be really, really specific in how you treat. The next thing you want to do is not jump in to a treatment plan. You want to start with a really gentle detox. So I use doTERRA's protocols and I use homeopathic protocols because your body is not going to be able to cleanse these pathogens if every system's bogged up. So imagine your body's just filled with garbage and it can't get rid of it, like this inflammation, like these chronic conditions, and your liver's backed up and your gut's backed up. So if you're like, well, I'm going to take all the echinacea and elderberry and all of the oils, your body's not going to have a way to process it and release it because it's just chocked full of trash. So let's get rid of the trash, clear out those pathways. So essentially the garbage trucks can come back through, pick up more trash and start cleaning out that body. And then get specific in your treatment. That's the time after you clear out everything. We can start saying, well, let's look at the different pathogens that are going on. Let's see the problem. And you really, most importantly, need to know that one thing is never just one thing. And what that means is there's usually an initial infection that's driving the bus, like multiple bacterial strains of Lyme or strep. So imagine the strep is driving this bus and it's just plowing through your body and you take the antibiotics and it kind of kills it, but it kind of doesn't. At least you know you're symptom free. Well, it can make a stop and pick up candida because now your immune system's down. Now we're opening the doors to everything to take a stop on. Epstein-Barr is another one that commonly hops on and it's just sitting in the back of the bus. So you're like, man, I'm going to get rid of all this candida, but the problem is candida is not driving the bus. It's a co-infection. And that's why we use those terms like stealth infection, because they just kind of sneak on the bus and they cause havoc and they make you feel like crap and there's nothing that's working. Candida and yeast infections are never alone. We also call that a secondary infection. So this is why it's so important to work with someone like me who's a functional medicine specialist, because when it comes to testing, all of these tests are up for interpretation by the physician looking at them. So for example, when we test for Epstein-Barr, there's a panel that we can run. But at the bottom of that panel, it gives a chart for the physician who's looking at it to say, oh, this is positive, this is a current infection, this is a past infection, this is a reinfection, and this is a chronic infection. And that physician has to go, yes, no, yes, maybe, I don't know. And I have seen people, I've worked with about 5 people who've had Epstein-Barr this year. And I'm like, for one, or actually 2 of them, I was like, you have a current and a chronic Epstein-Barr infection based on your blood work. They took that blood work to an immunologist who said, no, you don't have anything wrong with you. It's like, what? How is this possible? How can 2 physicians be looking at the same test and come up with something different? The other issue is like with Lyme disease. A lot of people have Lyme disease. 25% get the bite and have that target on their skin. That's so common with Lyme. That's how we know we have Lyme disease. But when we do the test, it's called the Western blot test, that 55% of patients with a current Lyme infection are missed. That's by Johns Hopkins. The CDC will actually says that 81% of Lyme positive patients are misdiagnosed and tested negative because the tests just suck. There's no way to test for chronic infections because kind of out of the system. And really, Epstein-Barr is so common and causes so many issues that it hides inside these cells. So the viruses are so cool, and this is why they're so difficult to treat, because unlike bacteria that float around in your body and we can target with antibiotics, viruses go into the cells and use our cells' DNA, mitochondria, RNA to start replicating, and they live and grow inside of our cells. And it actually shuts down the cell's ability to raise its hand and say, hey, I have a problem. So when a cell becomes infected, it can say, hey, immune system, and it puts out a marker, and the immune system says, oh, hey, there's something wrong with the cell. We need to kill it. Let's get rid of it. And so the Epstein-Barr turns off that signal, so the cell is just stuck with this virus living inside of it. And that's also why it's so difficult to test for. It's difficult to treat because we currently do not have medications that can get into cells. And this also causes so many symptoms that are so broad and wide. I don't feel good. That's what most people say. I just don't feel good. I don't know what's wrong with me. Nothing's working. What do you do for that? So we go by the symptoms. We go by, hey, Have you been in the woods? And a lot of people say, well, I have not been to Maine, or I'm not in the Northeast. I'm over in California. I'm in Oregon. I'm in Missouri. Oh, there's no big deal. I haven't been bitten by a tick. But what most people don't know about Lyme disease, it's not a tick disease. It is actually a mouse, a rat, and a sexually transmitted disease. So you don't know where you might have picked it up. And there's 4 different types of bacteria that we need to test and track and treat. So this becomes very, very complicated and overwhelming if you're looking at it on your own. So one, don't do this on your own. Make sure that you're working with me, someone like me, because we need to make sure that you're not chasing the stealth infections, the ones that are on the back on the bus, right? We need to make sure that you're chasing the right thing. We need to make sure that it's actually going on. We need to make sure that your inflammation's down. Everything's working right together by looking at your blood work, ordering those tests. So if you're feeling like nothing's working, that you're chronically ill, you may had an infection, you can't fight infections easily. I'll tell you what, I was at my chiropractor's office this week struggling with an issue. And she's like, I can't figure this out. I can't figure this out. I'm like, I know, I can't figure it out either. What am I going to do? And she stops, she looks at me, she goes, have you had Epstein-Barr? I'm like, yes, I did. I've actually had it 3 times, 3 recurrent infections. She goes, okay, here we go. And so now I'm on to the Epstein-Barr treatment of my life. And that's just the way it goes. So we keep peeling back those layers and figuring out where are things coming from, what's underlying. And it can be a slow process and it can be a quick process. It's just a process. So I'm here to walk you through that. If you would like, I would be honored to do a complimentary consultation with you. I always offer that free 30 minutes. Let's see what's going on. What have you tried? What worked? What hasn't worked? What's the right place for you? Get you started. And then I do an initial consultation where you get a 90-day plan with supplements, wellness, exercise, food, everything you need, because I'm going to figure out and explain to you what the root cause of your issues are. And then I have a 3-month program where we get to walk hand in hand, talk every week, and make sure that your body's healing. We're on the right plan. We change things because as your body heals, the plan changes, which is so cool that we can change things so fast. And we want to make sure you're doing the right thing. So I also have a group program, and then I'm doing a really special group program with another functional health coach, Maggie. And you're going to get both of us for 6 weeks, which is going to be awesome. So I would love to chat with you about this and share my resources with you. I hope this was helpful. I know it's a lot of maybes and ifs and sometimes and it depends answers, but now at least you know you have that information and you can put it on the table and say, is chronic illness and a chronic infection something that might be plaguing my health, and what can I do about it? So enjoy the rest of your day and join me every Tuesday right here at 1:30 for our Tuesday tips. All right, thanks everybody.